Good morning, everyone. My name is Michaela Fry. I'm the very proud MLA for Brooks Medicine Hat, and I have to say I'm so excited to be here this morning. Today comes as a very nice surprise for Medicine Hat, as we are going to be announcing some programs that will change lives and continue our continuum of care, as well as provide support to those suffering with addiction. As the MC for today, I was honored to introduce some very important people behind me. As I said, I'm the very proud MLA for Brooks Medicine Hat, Michaela Fry, and behind me I'm joined by Mayor Lindsay Clark, the Mayor of Medicine Hat, the Member of Parliament for Medicine Hat, Cardston Warner, MP Glenn Motz, the Ryan Oscar and Rick Armstrong from Our Collective Journey, Dr. Nathaniel Day, and Chief Mike Warden. So I want to kick things off this morning by turning things over to the Minister of Mental Health and Addictions, who's come down here from Calgary today, the Honourable Mike Ellis.
Wonderful, thank you. And thank you, Michaela. Ladies and gentlemen, thank you very much for having me. We have some very important announcements here, so I want to make sure that I have everything, and the department was wonderful. They got a huge speech for me, and I certainly could be like the Premier and talk off the cuff here, but I think it's important that we get these announcements because obviously they're very important to make sure that people in Southern Alberta are aware of the great stuff that is going on down here. So thank you, Michaela. Thank you for all the work that you do. What an awesome representative you have out here in Medicine Hat and certainly the Brooks area as well. I'm so happy to be here today in Medicine Hat to announce more of the recovery-oriented supports to help people with their pursuit in recovery. This support comes at a much needed time when addiction is taking the lives of far too many Albertans. This is concerning, and it is not in any way unique to Alberta. This is a problem that is being faced not just in Canada, but in North America. This is an illness that is relentless, it's progressive, and it's far too often fatal. My heart goes out to all those who've lost anyone to this illness. The reality for so many is that addiction ends in one of three ways: jail, institutions, or death. But the other side of the coin, I stand here today with some people who have found recovery from addiction, and that's worth celebrating. And there are so many stories out there here in Alberta of celebrations of people who have found that journey to recovery. And the reality of recovery is the difference it makes in people's lives. People who are supported in their pursuit of recovery don't succumb to their addiction. Rather, they go on to reconnect with their family, rediscover purpose and meaning in life, and ultimately give back to their community. It's important now, more than ever, that we remain committed to expanding access to treatments for many people in Alberta, and as many people as possible. And that's exactly what we're doing. So just recently, we have made significant advancements in our treatment capacity. We've been hard at work eliminating barriers to a range of services. 2 years ago, we announced that we would be funding an additional 4,000 treatment spaces. And two years ahead of schedule, we've actually doubled that commitment and funded over 8,000 additional annual treatment spaces. That means that over 8,000 more Albertans every year can access residential detox, treatment, and recovery services. These spaces have no more user fees. That's a game changer, completely eliminating financial barriers to treatment. We recently expanded the virtual opioid dependency program and began fully covering the costs of Sublocade for Albertans. Again, another game changer in this province. Sublocade lasts in a person's system for 30 days and provides stabilization, reducing cravings, and significantly enhancing protection against overdose. This move has been described as a very important advancement in addiction medicine and is available to any Albertan, regardless of their circumstances, same day, no matter where you live. You can access this life-saving medication by calling the virtual opioid dependency program. And we're not doing this alone. The government and our partners, such as police, EMS, fire, and not-for-profits, are working together with a common goal: to give Albertans the opportunity to access treatment and enter recovery, To anyone out there who is struggling with addiction, know that treatment works and recovery is possible. Recovery is possible for everyone, and everyone deserves an opportunity to recover. And that's our goal, and that is what we're fighting for each and every day. So when it comes to the harms that are caused by addiction, it is no secret that opioid-related fatalities are the most acute addiction-related harm occurring in our communities today. What many people don't know is that 70% of opioid-related fatalities actually happen in private residences. In order to reduce the harm caused by opioids and save lives, we partnered with the Alberta-based Aware 360 and STARS Monitoring to create the Digital Overdose Response System, or what is commonly known as DOORS. The DOORS app is free, it's confidential, and anonymous. It's an anonymous app that can be downloaded to any smartphone. It can be used to monitor someone who is using substances, connecting them with STARS, monitoring, and ultimately emergency medical services if they do indeed overdose. Part one of today's announcement is that starting today, the DOORS app is available for download and use across southern Alberta, including right here in Medicine Hat. This also includes surrounding communities such as Irvine, Redcliffe, as well as Bow Island, and many more. Overdose happens at home. So if your loved one, someone you know, or yourself are at risk of overdose, download the app and visit doorsapp.ca for more information. The DOORS system is just one innovative approach we're taking to improve access to a range of recovery-oriented services right here in Alberta. Another program we've been very excited to bring to Medicine Hat is a partnership between the Medicine Hat Police Service and the Virtual Opioid Dependency Program, or commonly known as VODP. In December, Alberta became the first jurisdiction in Canada to have police offer immediate access to addiction treatment for people who are arrested. We began in Calgary and as well as Edmonton, and we're already seeing significant uptake in those centers. By partnering with the Virtual Opioid Dependency Program, anyone who enters municipal cells in Medicine Hat will have immediate access to the addiction medicine team and, of course, the folks at VODP. They will be able to access evidence-based addiction treatments, medications like Suboxone and the newly announced Sublocade before they leave cells. These treatments minimize opioid withdrawal symptoms and cravings. The Virtual Opioid Dependency Program is not only available in cells, though. Any Albertan, anywhere in the province, can get the same-day access to addiction treatment with the Virtual Opioid Dependency Program. It's essentially treatment on demand, which is a game changer again, not just here in Alberta, but something that other jurisdictions are looking at the leadership of Alberta as to what we are doing. The program can be accessed by calling toll-free 1-844-383-7688, 7 days a week. And last but not least, I'm also very excited to announce that Alberta's government is providing a total of $825,000 to our friends here at Our Collective Journey over the next 3 years. Our Collective Journey, who I've had an opportunity to meet before, and their team have shown that they are willing to do whatever it takes to support people struggling with mental health and addiction in the pursuit of recovery. And we're very proud of the work that you guys do there. Alberta's government believes strongly in the power of peer support, shared experience, when someone is pursuing recovery. Connecting with others who have similar stories helps people find similarities and achieve their goals. This is what the group at Our Collective Journey is doing, and we're very proud to continue supporting their work. So, in conclusion, thanks to everyone at the Medicine Hat Police Service for hosting us here today, for participating in these life-saving programs. And as a former police officer myself, I know how important police are to ensuring that Albertans are supported in their pursuit of recovery. I've worked with countless men and women who have decided to change their lives for the better when interacting with the police. The reality is that we can keep our communities safe, we can treat addiction as a healthcare issue, and we don't have to choose between the two. So thank you again, and I'll now pass the podium on to Mayor Lindsay Clark to come up and say a few words. Welcome, Mayor.
Thank you very much. We are very grateful to the province for these added supports into our community. This has been a very difficult couple of years for everyone. And when you layer in trauma, financial issues, isolation, family issues, it's pretty easy to see why so many people in our community are struggling and in need of help. There isn't, just like recovery itself, there isn't going to be one quick fix. There's no one size fits all solution, but we need to work together to incrementally progress towards back to a healthy community. And we all play a role. It's all of our responsibility to restore the health of our community. We all can contribute in some way. So again, I appreciate these added supports and look forward to continued problem solving and solution finding around these critical issues. Thank you. I am going to introduce Dr. Day.
Good morning. Albertans can be really pleased and proud to know that Alberta is leading the way with respect to access to evidence-based treatment for opioid addictions. Today, any Albertan can call 1-844-383-7688, no matter where they live, and they'll be immediately connected with a healthcare professional who will compassionately and carefully guide that person through the next steps of their care. And we will be able to help that person start evidence-based treatments that very same day. This program that is available to every single Albertan is envied across jurisdictions in North America and is being looked at by international jurisdictions. And it's something that we can be very pleased with and proud of. Now, of course, it's not the only piece of the puzzle, and there are lots of things that still need to be done. We know that 50% of people who die of opioid overdoses have had a touch point with police services or with corrections in the year before they died. And so here we are, because of that, to increase access to treatment, evidence-based gold standard treatment for everybody when they're accessing services or where they're required to access services here at the Medicine Hat Police Service. We piloted this starting in December, and since December, we have had over 200 people, think about that, 200 people say, I want help, I need help today. And we're able to compassionately and effectively get them started on treatment where their withdrawal symptoms are relieved, they're able to see that the medications can be effective for them, and we're able to help them bridge care so that they can move on to the next steps in their care and towards their recovery journey. I am so pleased to stand here with the Medicine Hat Police Service. First responders care for people. They are in direct contact with people who are struggling every day. They are at the front lines of the addiction epidemic. The virtual opioid dependency program will work with Medicine Hat Police to help people suffering with opioid withdrawal get this evidence-based treatment so that they can compassionately and appropriately get relief of their suffering right then in the moment and have the option to start a life-changing journey of recovery. I'm also very pleased that the DOORS app is now available here in your community. Anyone who is using should download the app and use it. It is saving lives. Albertans also have access to the injectable treatment medication Sublocade, which resolves withdrawal, reduces cravings, and can reduce overdose risk. If you are using opioids, call the virtual opioid dependency program or see your local provider. Medication options like Sublocade can save your life. Of course, there's much yet to do. Chances are that you know someone who has lost a loved one to opioids. We can compassionately and safely help those experiencing the grind of addiction find meaningful recovery, hope, and healing. It's happening every day all across Alberta. Thank you.
And thank you, Dr. Day. Your passion for this program has just been outstanding. The work you've done with us is second to none. They've been able to get us into a place where we can participate in this program. So I would start out this morning introducing myself. My name is Mike Ward, and I am the Chief of the Medicine Hat Police Service. Today, I'm pleased to be part of this joint announcement with the Government of Alberta declaring our participation in the Virtual Opioid Dependency Program, as well as an introduction of the Digital Overdose Response System app and funding for a local community-based mental health and addictions recovery organization, Our Collective Journey. Over the past 14 months, the City of Medicine Hat has experienced an alarming increase in the number of overdose situations, many of them leading to tragic outcomes from opioid and other forms of drug use. In 2021, 38 Medicine Hat citizens lost their life to drug overdose. This is a tragedy and something that we as a community need to collectively come together with solutions to address. The Virtual Opioid Dependency Program is a harm reduction, evidence-based medication treatment that will soon be offered to individuals who are brought into our custody and voluntarily choose treatment to help them tackle their struggle with addiction. Providing health-based, safe options for these members of our community is something we all have a responsibility to endorse and support, allowing us to play a part in a compassionate approach to those suffering with addiction. The Digital Overdose Response System app and funding for Our Collective Journey are also additional and valuable health care focused initiatives intended to help stop the suffering in our community. I'd like to take this opportunity to thank Minister Ellis and the Government of Alberta for supporting solutions to this healthcare crisis. Thank you. And I think, Rick, you're up next.
Thanks. Hello, I'm Rick Armstrong. I'm the Executive Director of Our Collective Journey. We're a nonprofit that formed here locally in October of 2020. And I would like to start by thanking Minister Ellis and MLA Fry's support in helping fund our objectives here. So some quick history. We've, over the course of the last approximately year and a half, we've helped support just under 300 local people in our community to help navigate to a position of recovery as opposed to addiction. We've introduced the community to a recovery coach program that follows the recovery-oriented system of care that's put forth by the province. Out of those 280 some residents that we've helped support, I think it's really important to focus on these are people that we know in our community. These are our friends, our family, our children, our parents. These aren't faceless people that are losing their battle every day. So I think it's very important that we come together and thankfully now with the support of the province, we'll be able to increase that number and sustain that for years to come. So thank you very much.
Before we get started, and I don't want to put Member of Parliament Motts on the hot seat, but it's politics, right? So, I think everybody needs to know we thank Member of Parliament Motts for being here, and for those that do not know, he certainly was a member of the Medicine Hat Police Service for many, many years. And sir, I just want to thank you for your service. I want to thank you for everything you're doing in Ottawa, and if you'd like to take a moment here, I think it'd be appreciated.
Mr. Ellis, MLA Fry, Mayor Clark, Dr. Day, Chief Warden, thanks for the invite, and it's great to be here. I'm really impressed. When I was policing here, with some of the members that are in the back, we had an opioid crisis for a long time. We had an overdose crisis for a long time. And where I was looking for solutions to solve that. And this is one of them. It's not the only one that'll be, it's not the only one that can be, but it is one of them. And we are always thinking about how can we involve community to help community. And this is an example of that. So good for you for stepping up to the plate, government. We always get heat, for not doing enough, and sometimes it's warranted. And here's an example of how communities can work together. And I'm looking forward to the impact this has on people's lives locally and in the region. I'm looking forward to seeing how this can be expanded beyond the borders of Alberta and can help save the lives of Canadians. So thank you.